Hi, Katie. Welcome to What Does Good Care Look Like? And obviously, I'm going to ask you that question.
Yes.
But before we do, I was very interested to hear. Well, I think I already knew this, but you literally grew up in care. That's what you say.
Yeah, that's true. Yeah, I say to people that I grew up in care, not in a sad way. My grandparents started a nursing home in the 80s. Very classic story. My grandfather ran a hotel and my grandmother was a nurse. So obviously,
They
let's
combined
these
the
together.
accommodation with the nursing.
Mm-hmm.
Yeah.
Yeah, exactly. So very sort of traditional sort of 20-bed Victorian terrace conversion into a residential care home. My mum started working there in the 90s. And so as a kid, I basically spent all of my time there, sort of school holidays. My grandparents lived next door, so anytime I was staying with them. And so I had kind of an amazing childhood.
Yeah.
Really hanging out in sort of the lounge, talking to lots and lots of the residents who were there. I don't know if they necessarily appreciated it, but me and my little brother used to hook up our Nintendo to the lounge computer.
Was it Sonic?
It was not. It was Super Mario.
Okay, yeah.
And I
Classic.
learned a huge amount from some of the residents in terms of how to play Super Mario. I must have been about 6 or 7 years old and had them helping me with it. So it was really...
I mean, in modern terms, that is increasing dexterity.
Exactly.
I think that's a very
I'm sure
good
it
model.
has really good things for people's cognition as well.
Yeah.
I mean, I am not a clinician, but, I'm just going to assert that anyway.
This was the early technology that you introduced to care.
Absolutely, yeah, it's been a trend. So basically, like throughout the 90s and early 2000s, spent a lot of time things you probably couldn't do now, like if I was off sick from school and my mum had to go into work, so I'd go and sleep in one of the spare rooms or something.
Probably a little bit frowned on.
Yeah, but it was fine back then. And then, started working as a cleaner for some pocket money from when I was 13, kitchen from 16, started working as a carer from 18 before I went off to university. So a really happy childhood there.
So all of your childhood is intermixed with this. So I'm guessing then that became a really good backdrop for the values that you brought forward with you into what good care does look like.
Yeah, absolutely. So I mean, I think it's interesting having that as a childhood, because I think as a family we therefore talked a lot more about the realities of what happens at end of life. We was not a taboo subject for us at all to talk about death. I think everybody in my family knows everybody's family funeral plans from when I was really quite a young kid, because it wasn't a scary thing. We talked a lot about what, old age should look like in particular. And I think that really has driven how I feel about what good care is, because for me it's tied up in that feeling of community, of family. Exactly. Really personalized, lots of joy, lots of happiness. And not everybody wanted to have little kids running around, obviously, but you understood that, and that's fine, because different people want different things. And I think that's really where you see good care, is in that recognition of the same thing doesn't fit for everybody, but everybody has a right to choose what they'd like to do.
Yeah, absolutely. I agree with that. But I also think there's probably value, my feelings on that kind of mixture, the gender mix of services and, running a day service, perhaps for older adults with a nursery attached. I think there's genuine benefit to that. And like you say, there's downsides, like there is with anything, but it creates that community sense, doesn't it?
Definitely. And I think a lot of younger people are unlikely to have spent much time with different generations outside of their own immediate nuclear family. And there's a huge amount of learning that goes in both ways by having sort of mixed generational living situations or experience with each other. So for me, I think there's a lot of value. I'm really, really interested in the model around having nurseries on the same site as day centres. I think it's in the Netherlands as well, and in Denmark, where you've got university students living in nursing homes as well. And I just think we can tend to really only talk to other generations either at work potentially or within our nuclear family, but actually having that broad range of different experiences throughout your entire life is really, really important and valuable.
Absolutely, I agree with that. So then you did what all good teenagers do and rebelled against social care.
Absolutely.
Not getting involved in this.
Yeah.
I'm going off to university and I'm going to do
English degree, first of all. I was like, as far away from the caring environment. Everyone was like, oh, you're going to be a nurse. And I was like, no, I spent a lot of time with nurses. I know too much about what that entails. So yeah, went and did an English degree, then ran pubs for a while in central London. Interestingly, sort of also a very sort of similar workforce in many ways. Talk about people who tend to be quite short term, a lot of vacancies, quite low paid work as well, just demographically obviously different. And then went and did a master's degree in Viking and medieval Norse studies.
Amazing.
Yeah, incredible. Weirdly doesn't come up at work much.
And why not?
I know, but yeah, I was really interested in sort of history of language and of storytelling, which is why I decided to go and do like Nordic studies, because a lot of our like English literature all has come from sort of the Scandinavian countries, Beowulf probably most famously. And so, yeah, decided to go and do that. Lived in Iceland for a couple of years.
Did you really?
I did, yeah.
I went to Iceland a few years ago and it was beautiful.
It is gorgeous.
The colours are like nothing I can describe. Yes. They actually feel like it's a fairy tale.
It's amazing.
Trolls live there.
Did you go to the sulphur fields where you can see the neon green? Yeah. But like in nature, I didn't realise nature could create that colour.
I know.
Amazing stuff.
It is really good.
Yeah.
But so few people there. So
yeah, 300,000 people in the entire country, which was very surreal to go from that living environment. And I was there for 2 years. And I remember coming back one Christmas to visit family and got off the plane, realised I'd forgotten a pair of like dress shoes to go to like a nice party, and immediately went to Oxford Street to go at Christmas in December to go buy a pair of shoes. And I think there was probably more people on that one shoe shop than I had seen in one place for about 8 months. I was like, oh God, what is happening here?
Yeah. That's a bit of a culture change.
A little bit. But yeah, it was an amazing experience being out there. I'm a big sort of believer that when you get the opportunity to travel, getting to actually live somewhere for a while means you really understand a lot more about the culture and sort of what's happening there. So
did you find any major cultural differences with how they care for the elderly and what takes place over there?
I mean, I
suppose you might not have been looking for it necessarily while you were there.
Not so much in terms of care for the elderly. I thought it was very interesting around children, actually. So it's a lot less stigmatised to have children young there and to be single-parent households as well, comparative to the UK.
Interesting.
So actually, I was really surprised at how young a lot of the people were who were having kids. It's quite common to meet people in 20, 21, 22, which you don't really see here so much anymore. And to not be in a relationship with the other parent, but to be co-parenting really well. They have a culture, so if you go to university or if you are in work, you have free childcare for your child. And so you are not disadvantaged and stopped from progressing in your career by having a kid young. So it was a very different approach.
Yeah.
And it's so safe there. So it's a big thing. You'll see, I don't know if you saw it in Iceland, where you have the pushchairs and prams outside coffee shops with the baby still inside them.
Yeah, I did.
Yeah, well, they think it's very important for babies to get used to like the cold weather and the outside, but also it's quite cramped in a coffee shop. So it seems absolutely bonkers here. But yeah, you'll go to a coffee shop and it's just like a row of prams with babies and people sort of vaguely looking through the window to make sure they're okay.
They are there somewhere. It's okay.
But yeah, just a very different culture in terms of like how you are with children. So.
Bringing that back then, I always think no one leaves social care really. They always get suckered back in. So what brought you back into this world of...
Yeah, a variety of things. So I moved back to the UK, so for what I thought was going to be just a really brief sort of 6 months period. And then my grandmother, the one who was a nurse, who was working at the nursing home, so she had vascular dementia. At this point, my grandfather had passed and she had actually moved into the nursing home, which she used to work in herself and was being cared for there. Yeah. Caused absolute havoc with all of the staff. Even when she was being cared for, she was there being like hospital corners on absolutely everything. Did
she do the inspections?
Yeah.
Did she audit it?
Absolutely. Yeah. You could have got her like a clipboard and she would have been there, been like doing meds rounds, like, no, you absolutely...
feedback from everyone.
Exactly. It was amazing. So moved back, really wanted to sort of spend a lot more time with her because we were very, very close. So helped out with her outpatients appointments and wanted to spend more time. Managed to get a job for what was meant to be just like a very brief piece of research. So the Care Provider Alliance had some funding from NHS Digital. This is back sort of 2016, 2017 to look at what care homes knew about data protection and GDPR. I just finished doing a research master's, but obviously had a background in social care. I was like, oh, I'll see if I can do my job. That sounds quite interesting. Gives me the opportunity as well to sort of work from home and sort of spend time with my grandmother. So did that. Then GDPR came in, which obviously was a huge change in data protection legislation in this country. What I thought was going to be a really short 6 months suddenly was like several years. I ended up seconded into NHS Digital's social care programme and doing some work there, looking at sort of some of the very first national government funded digital transformation programmes for the care sector. And then in 2019, left NHS Digital to go set up Digital Care Hub, which is where I am now.
Which is where you are now.
Yeah.
And I guess the impact of your work, so it stems from experience, doesn't it?
Yes, absolutely.
The reason why you were able to kind of move quite seamlessly, I suppose, into those roles were not only your history, but the fact that you digitised in your family's care home.
In the family care home. So we moved from that sort of traditional Victorian care home about 2008. My mum had mainly taken over as MD then. My grandparents had retired, though. Do you ever really retire from social care?
Not if you're living there as well.
No, all of our Sunday lunches as a family are very much like still discussing what's going on. And she decided with a purpose build that she wanted it to be completely paper free. That was sort of the goal. And this is sort of very early in that process. So I saw the benefits, some of the struggles.
What year was this?
This is, I think, 2008, 2010 was when
so
the build
pretty
was
early
happening.
on then,
Yeah. And we made some mistakes. Like bought one system which just was absolutely not right for us, ended up having to scrap it and start all over again, and like obviously the money of it. But when we got something which worked well, I really saw sort of the benefits of how the technology really supported the staff at that time. At that time, most of the tech was for staff to use as opposed to things which were particularly for residents, which obviously has changed now. And so I became quite passionate that when we find the right technology, it can be an incredible support tool and have a lot of benefits. But we don't necessarily have a lot of time and headspace in social care to be keeping track of all of the latest digital trends all of the time.
People say this to me all the time. It's like, how do I know what to buy? How do I know it works? And I guess my advice is always around like peer review.
Absolutely.
And having not signing up to 10-year contracts.
Yeah, ideally. Yeah.
Like maybe 12 months to start with, 6 months if you can get away with it, that kind of thing.
Yeah, go visit somebody who's already using it, have a little bit of a test on their system if you can. Absolutely, all of these things. So I just really think that the digital space is really fascinating time to be in it. Also, I think with Digital Care Hub, the timing sort of worked out pretty well. So in 2019, there were care services obviously digitized then and digitizing, but it wasn't as widespread, and people were a bit like, oh, nobody really is going to want to have digital support.
Why would I pay for this when there's no funding for this? It's just an extra cost for me.
Exactly.
That kind of thing.
And then COVID.
And
right?
then COVID happened.
So suddenly 2020, a lot of people wanted help about what technology they should purchase. They really wanted to know sort of, how they could keep people in touch with their families and all of that. And so we sort of pivoted quite quickly. We ended up setting up a helpline, which still runs now, which is completely free for the care sector, for any kind of people to call up or email us, ask questions about technology, and just get an unbiased sort of supportive ear to listen to, really.
That cultural shift was pretty dramatic, wasn't it? I started it, just checking, in 2019. And having been on the other side of the fence, and, I do say this, I do admit this, and probably being a bit of a naysayer at the time, as a care manager, not seeing the true benefits and thinking it was kind of, tech taking over and all of those
used
things.
To yell at me all the time. It's like, I came into this to care, Katie. I didn't come into this to do data.
Exactly. But within, I think I was saying to you recently that I remember really early days having to educate on hearts and minds a lot about why we're even doing this in the first place. What's the point of this, and how actually our sector is the last to digitise.
Yeah,
very much so.
Yeah,
and there's obviously teething problems with anything that's new. But 2020 onwards, I recalled trying to get any local authority into a Teams meeting was pretty slim to none.
Yeah.
And then instantly, here we are all using it because we need to.
Well, this is it. I think more and more when I think about technology in the care sector and things, it's not really about the tech, it is the culture change that you were talking about, you know, and sadly culture change is the bit which is hard to do. You know, the technology's been around for a while, it's improving all of the time, but most of the tech, it works, it's fine. But actually doing a whole change management process is incredibly difficult. And particularly if, as the person leading that, if you're not particularly confident in it, because technology still feels like something over here which IT should be thinking about and not something that you would be thinking about. It can then be quite hard to take people on that journey to sort of say, this is why we've chosen to go this way. This is sort of the steps. This is where our two-way communication is going to be about if something's not working well, how can we improve it or make it right, as opposed to just immediately doesn't work, won't use it sort of thing, which can be really disheartening. But, you know, you have to understand that many of the people who are the biggest naysayers about technology, either it hasn't been explained to them why they need to do it. You still get a lot of fear there. People are still very worried what it means for them, for their jobs, and that sort of thing. And I think working through that is sort of the most important bit, as regardless of whatever technology you're choosing.
Yeah, absolutely. 90% of the work that we do is about that hearts and minds piece, is about, you know, the whys and the outcomes and the processes, because that we can throw tech at a problem, but actually it's not going to do anything unless the people operating it are engaged with it, that they write it into their day-to-day, that it becomes the process. It can't be an add-on.
Well, this is it. I remember this is years ago when I was still at NHS Digital, and we were talking about doing digital medical discharge summaries from hospitals to care homes and having them arriving instantly. I mean, a conversation I think is still happening now. But the main problem we were trying to solve then was it was really common to get a paper medical discharge summary. I'm sure you've seen these, which is said somebody both has capacity and doesn't have capacity, doesn't have a full list of medication. Like, it's really, really difficult to read. The quality of the information was really poor. And it's like, okay, but if we digitize that without changing hearts and mind, we will have that poor quality information quicker, but it's not going to improve the actual problem, which is that
we've still got poor quality information.
Exactly. And we can only get that if we can explain to the people writing the summaries, this is the negative consequences of putting it in this way. You need to change your process. And then, sure, digitize it, send it by fax, send it by carrier pigeon, as long as the information is there at the right time. That's the important bit.
You said something earlier about that there's a feeling that technology belongs in the tech department with IT. And I always think that's a really interesting view, because when you speak to people who work in IT, particularly in care providers, their view is that their role to play is to deal with the technology that the staff need to use to carry out their day-to-day role. But actually there's a service level there's an operational side, isn't there, of technology? And actually I believe that technology actually sits in ops departments, not in tech departments.
Yeah, exactly, because your tech department could be like, everything's running completely smoothly, we haven't had any outages or any glitches. Doesn't mean anyone's using it.
Yes, absolutely.
But technically it's all running perfectly well. Like, ops have to be involved.
And they have to be the instigators and the leaders of it, because ultimately it's their teams that are using it that should have the problem that's being solved by it. And if they don't have the problem that's being solved by it, then it probably shouldn't be used in the first place.
Yeah, I mean, I think that's a really interesting point as well, and something we don't talk about very often in the sector is it's fine to trial things, do a short pilot of a piece of tech and then go, well, we've evaluated it. It's not for us, actually. I think sometimes we have a bit of a sunk cost fallacy around all of this. It's like, oh no, but we said we're going to do this, and so now we must stick with it. I'm going to
see it through to the bitter end, even though I found out month 1 it doesn't work.
Exactly, right? And sometimes we should just put our hands up and be like, we tried it. Wasn't for us. Fine.
Yeah, no, I agree. And it's that agility, I think, that you need, isn't it, from a tech supplier, that actually they're going to work with the problem with you. They're going to work through the problem with you and get to the end of whatever outcome it is that you've set at the start. But I think sometimes we pick up tech for tech's sake, that we know we need to do it, we're going to do something, But actually, if you haven't started with the root of the problem,
Yeah.
we don't know what we're aiming for.
Exactly. Like, that's my number one piece of advice to people when they ask me about what tech they should be using in the care sector. I was like, I don't know, what are your pain points?
Yeah.
What problems are you trying to solve,
Yeah.
you know? And then we can go, is technology the right solution here? Because it might not be. It's fine, you know, jinx. Yeah.
Did one of us have to be silent now until they say their name or something? I think that might be
Oh, yeah.
I think that might be a new thing.
Might be an interesting podcast to just
Yeah,
be silent for 5 minutes.
It's all right. We said jinx. Okay, Brill. So thinking then about staff and how to implement change at this level, how do we engage? How do we start all of that?
Sure. So I think there's sort of two different sides of this. So there are always going to be some staff who are really excited about technology, who are really interested. I think we tend to think they're younger members of staff, not necessarily. It's like all ages, and people will know who they are in their teams. So firstly, I'd say, how can you empower those members of staff to really take their ideas on board? If they're the people who are coming to you with ideas and solutions, brilliant. How can we empower them? How can we make them a digital champion or something similar? Skills for Care have great job descriptions and resources for that. Actually, it doesn't all have to be on the registered manager or the MD or the nominated individual. It can be people who are just really passionate in the staff team. So I would say, firstly, empower those members of staff, particularly around peer learning and support, which is going to be really helpful. People who are more scared of tech and more likely to go speak to one of their colleagues than they are to go talk to the IT team or the ops director.
Well, their manager, they probably don't want to admit that actually it's a skill that they don't feel confident in.
Exactly. Yeah. And then for those who don't feel confident around technology, which, you know, there is still like a sizable minority, I would say, and they tend to be quite vocal as well. If it's possible, I think if they can be involved in the sort of choosing process and sort of be empowered in that way, that can be helpful. Like, not necessarily like doing a long list of 20 different tech options, but if you've said, okay, these are the 3 different care record solutions, for example, that we think would work for us, get some of your staff in to test them, to trial them, find out which ones they like best, because actually that means that they're then going to go back to the rest of the team and say, oh, I got to pick this one. I think this is the best one.
And they're going to be the people using it ultimately, aren't they, on a day-to-day basis? It needs to function for them.
Exactly. Yeah. So I think that is really important. Having members of staff involved in that process, if they are the end users, is really, really vital. And also, be mobile first. Most people who are not confident with technology are just not confident with technology at work. Does all of your team need to be proficient at Excel? Almost certainly not.
No.
Can your team use Facebook or Amazon or similar on their phones? Can they do mobile banking? I know some can't, but the majority will be. Pointing out how this new app for work is very similar to apps they are already used to using in their personal life, I think can be really helpful as well.
A large part of the work that you've been doing over the past probably nearly decade, isn't it?
Nearly a decade.
Sorry to remind you.
Yeah, oh God.
Is the digital care records rollout.
Yeah.
So now we've hit about 80%, is it, of all services that have
80% of all CQC registered care services in England are now using a digital care record.
Brill.
Some people might still remember them as electronic care planning systems. It's the same thing, but we've had a name change as well. Which, I mean, it's been an absolutely phenomenal change. You know, we talked at the beginning about how the care sector has been quite slow to digitise comparative to other sectors. But if you think back in 2021, so less than 40% were using a care record, a digital care record. And now to get to 80% in, just over 4 years is really, really impressive.
Yeah.
Yeah.
And I guess that's because it was mandated, there was funding, there was your team putting a lot of work and energy behind engagement with people.
Yeah, so the Digitising Social Care Programme in NHS England in the Transformation Directorate. So they had a 3-year programme with £150 million of funding, which is the first sort of major injection of funding into the social care sector for technology that we've seen from national government. And it's not a lot of money if you compare to it, like to the amount the hospitals got, for example, where you've got, I think it's about 4 billion, which went into hospital digitisation. So to have that scale of change for 150 million, I think is really impressive. And some of that's gone to sort of covering part of first year costs, but a lot of that also has gone into having people in local areas to support with rollout, with implementation, with project management, to give people some of that headspace really to do the change programs necessary. And also developing like an assured list of suppliers.
Gave confidence, didn't it?
Absolutely, because, you know, there are so many different people on the market. It can be really hard to know who's really good, who's maybe a little bit of a cowboy. So actually saying, okay, these have been assured by NHS England at meeting minimum standards. I think that confidence for a lot of people, especially if you're less confident around technology, has just been such a game changer for us all.
I think that was a really good move. And you must be proud of that. That's like a major...
Absolutely. I'm really, really proud of it. Because especially with some of the benefits, right, that we're seeing from digital care records. So you are seeing much more detailed care plans quite often because people feel more comfortable with technology and sort of being prompted to put more information in, especially if you're thinking the large number of people working in the sector who have English as a second language or may themselves have a difficulty with reading or writing, be dyslexic. We see high levels of dyslexia. So actually saying, okay, well, you can be doing digital records at the point of care rather than at end of shift having to sit there with your paper record, spending hours being like, wait, what did we do, and all of that. I think that it's
in real time, isn't it? So you don't miss things as much.
Exactly.
What other impacts do you think? I'm guessing like just the logistics. We were talking to Stella, who runs Stella Care Northwest, and she is a home care service. So for them, like the reality of managing paper records is just extreme, isn't it?
Exactly.
You've got paper records in every home, and then you're having to collect them in to
take them back to the office.
And then, how do you do all of that?
So the logistics, so much better. Also, obviously, we all sat down with sort of our paper care records and do a bit of a retrospective and look back at them and try and spot trends and patterns. That's really hard on paper and takes a huge amount of time. Whereas if you are logging, for example, somebody's mood every day and somebody's weight every day, you might not notice in person that there's been a change. But if the system can automatically flag, oh, actually this person has been consistently quite down recently, and that's something we've seen over the last month, it's been getting worse, you can then have that flagged to you automatically and have a prompt and then be proactive about sort of having a chat with somebody, being like, you know, are you okay? Do you need more help? Is there something that's going on? And particularly if you're in a service where you're using a lot of agency staff, so you don't necessarily have that same consistent caregiver there all of the time, that I think has been massive in terms of outcomes for people.
Because you're likely to miss things, aren't you? If you know, even with the most consistent of teams, you've still got a different face on every shift. So it's easy, isn't it, for things. I was speaking to a team recently where they said that the data that they'd received through the monitoring that we provided enabled them to like pick something up a lot quicker because they're avoiding that period where people as a team think, oh, something's happening, or as individuals think something might be happening, and then you have to get together collectively as a team and go, oh yeah, something might be happening, and then you have to evidence that. It's kind of it jumps through those stages, doesn't it?
Yeah, exactly that. It's also brilliant for transparency and relationships with like friends and family. So if you're using a friends and family portal, for example, which you don't have to, but is an add-on for nearly all of these systems, with consent, obviously, people's loved ones can see what activities they've done that day. And if you're thinking, you know, say you've got a daughter who's living in London, son up in Newcastle, the person is wearing like the Midlands right now and that's where their home is, they can feel quite a lot of guilt about not being able to be there. They might be calling every day to be like, you know, how's mum, how's dad? Actually, if you can log into a portal, can see and be like, oh, like there's photos. I know that they've been out today. I know that they went to this activity. That can really improve relationships within that family unit, but also between the family and the care service, which I think is really good. And also seeing some care providers I talk to are finding it's really helpful for relationships with their commissioners because it's easier to actually sort of quantify the care that they are delivering. They can say, this is the care we give, this is how much it costs to give that care. So then when it comes up to contract negotiations, you can be like, no, we have a breakdown.
We have evidence.
Loads of evidence.
Yeah.
So
absolutely.
I do think it's really, really changed a lot of how we work in the sector in terms of speeding up and efficiency. So yeah, huge.
And that's what it's there for, isn't it? It's that tool to take away the pain of the admin jobs, because let's face it, social care is quite admin heavy.
Yeah, we're quite highly regulated.
Yes.
There's a lot of paperwork we need to do all
there
of the
is.
time. So if we can have that, so people aren't spending their evenings, their weekends, or if they're working
Or just
nights,
staying
and
late
mornings.
on shift.
Yeah, exactly.
15 minutes extra to do the logs and all of the rest of it that comes with it.
Exactly.
Do you think then digitising is better? It is better for the sector overall?
Overall, yes, I do. With the caveat that I'm very much not pro all digitisation or technology for the sake of it. But I think where technology is well evidenced, where it can be co-produced and co-created with people in the sector, that there's so many benefits to see from it. And I think, there's going to be more and more technologies which we'll see have wide uptake and usage.
Any mandated, do you think?
I mean, I don't
A
have
bit like digital care record.
Yeah,
I suppose the thing is, we saw the impact of doing that, and we saw the impact of putting funding behind it and mandating it by a certain time period. I know there's been extensions, but that always happens in these kind of projects.
Yes. So,
do we think something like monitoring technology or other assistive technologies, or just having technology as part of your care plan and thinking maybe a bit more tech first, do you think that will come?
So I'm going to caveat this that I don't work for government, so I don't have any inside knowledge about this.
No inside information.
No, not at all. But I think in terms of mandation, I would be very pro the mandation of electronic medication administration records.
Yeah.
Not least because it's actually one of the most evidenced bits of technology that we have in the sector. So Cardiff University did a huge report around safety of electronic medication systems, EMR, found that it massively reduces medication errors, massively reduces polypharmacy as well. So actually care outcomes, it's just a complete game changer. It is so much safer than using a paper mar chart, just fundamentally. Also, if we had everybody using electronic med systems, we then could have them fully integrated with GPs, fully integrated with pharmacies. Yeah. We wouldn't have to be doing that call around being like, okay, have you approved the repeat prescription? Okay, can I go pick up the medication?
Yeah.
All of that admin.
All of the logistics of that scenario as well again, isn't it?
If it could just be automatically, the system knows that you're running low on a specific medication, it automatically pings over to the GP. They can see that in their own system, go, okay, yes, do that, or review, come and have a visit.
We don't need support to deliver simple tasks then. The system does it for us.
Exactly. Yeah. So that, I think, would be brilliant. In terms of monitoring technologies, I'd like to see much wider uptake of it. I think particularly things around sort of falls prevention is, again, really well evidenced now. My concern with monitoring technologies and mandation is if somebody very understandably does not wish to have some kind of monitoring or surveillance in their own home, a lot of people are willing to sort of give up some of their privacy in exchange for increased feelings of safety. Brilliant, amazing. But if somebody is going, well, no, I want care and support, but I don't want to have even the most privacy safe, saving bit of tech, what does that mean for them if that's the only way services
there needs to be choice, doesn't there?
Yeah, so there needs to be choice. But I do think it should be offered as a service standard.
Yeah.
Definitely, particularly if we want people to be living in their own homes for longer. We have a lot of options around sort of assistive technology now, which should be more widely available, should be funded for people. I'm just making my pitch in case government is listening. I think the tech first for people when they're sort of like in the early stages of care particularly should be the approach.
Yeah. And anything really that can support that efficiency of the system when we're so stretched, I guess, would be really helpful.
Exactly.
But absolutely, when we're talking about people's own interactions with technology, they need to be the controllers of that, don't they, in terms of what's being used and what that looks like.
Exactly. And some people are like really excited for it. Like I was talking to a lady recently who cannot wait for there to be full on like service robots who can help her get up and go to bed, because she's a woman in her 50s. She needs care and support to be able to get changed, to like wash, to get into and out of bed. She doesn't want a carer coming in at 7 p.m. She's 50. She wants to go out and do things, you know. So she's like, well, if I had more option, so choose when I go to bed like anybody else could, and the robot could help me with that,
then I'm happy for that.
Exactly.
Yeah. How's how does AI fit into all of this? I think we're looking ahead now, aren't we, into how data can transfer across health and care services. Again, we need to centrally have the person in the middle of that because it's their data, their choice. But how do you see this all kind of playing together with one another?
Yeah, I mean, I think what care looks like now is going to be so alien in 10 years' time. I think the approach in 10 years is going to be completely different and a bit hard for us to envision. I think artificial intelligence will play a large role in that. If we're talking about new forms of AI, so more of the generative AI, large language models, which we're seeing, so your ChatGPTs, co-pilots and all of those, I do have quite a lot of concerns at the moment with how it's being rolled out because it's so widely available, because a lot of it's free. A lot of care staff will be using this even if managers don't know that they are, right? So you've got risks around data protection, which you've already mentioned, and privacy. So, I mean, I would say if you are running a care service and you don't have a policy about the use of AI, I would put one in very quickly, just so your staff know.
Even if you haven't requested it as part of the work that people are delivering, you don't know that they're not using it. So you need to, it's like a social media policy, isn't it? You need to have those controls over it.
Yeah, definitely. But I mean, I think people are already doing incredible stuff with AI. I'm meeting a lot of care services as well who are kind of creating their own, which is really exciting about how accessible all of this is. So, I mean, some really amazing examples that I've seen with how people are using it at the moment are to use AI to basically generate a podcast form of their policies and procedures. So then rather than having to read like a policy guidebook, you can listen to the policies. It's only American AI voices at the moment. So that might be a bit disconcerting, but it makes it more accessible.
Yeah.
Also know people who have put all of their policies into a closed loop AI. So rather than a member of staff coming to them and saying, how do I know how many holiday days I have left? How do I know how sick pay is calculated? They can just basically ask their work chatbot, how much holiday do I have? And it just pops up instantly on their phone. So that can be, for staff, they have a lot more information at their fingertips about what they're doing.
And I guess what people like about that format as well is that they can ask the question in a way that makes sense to them. Yeah. And they get it back in that same language, don't they?
Exactly, yeah. Oh, and actually, speaking of language, translation is a huge thing for AI. I think that's going to be incredibly helpful. And I think what's going to be massively different is how it's going to make things so much more user-friendly. So I know when I talk to people a lot about digital care record platforms or like rostering systems, people sometimes struggle to know how to find where the reports are, for example, or they're like, oh, I know that technically there's a dashboard here and I can do this, this and this, but I don't necessarily know how to find it. What a game changer it would be to be able to just have an internal chatbot to that and you say, bring me up a report of every fall this person has had in the last 6 months, and it just would auto-populate that for you. You wouldn't have to be doing all of that yourself. I think it would massively save time, and also means people would need less sort of data analysis training to be able to get into some of that information. So I think that's really cool. I do have a lot of concerns around potential bias in these systems and the fact that they're not necessarily completely well evidenced right now. So for me, I don't think that people should be using a generative AI to create a care plan. Don't put personal information into one in the first place, obviously. But I don't think we necessarily have evidence that an AI generated care plan is truly personalized to that person, because AI creates things which are statistically most likely, which is the opposite of personalization.
Yeah, it is. So, and it's AI is using the information that is presented to it.
Yes.
So you have to have complete control and analysis and specialism about the information that's being input in order to deliver an output that you want that would be relevant to that cause and that situation. So I think that's the thing that we need to be really careful of at the moment, is that we're not, as you say, generalising people, generalising their life plans. But as a tool that can speed up certain admin processes where there's no personal information and actually limited risk. It's worth an explore.
Absolutely worth an explore. Would really recommend people do just give it a go, particularly a lot of these tools which are basically free. Try, see what's working. I spoke to a retirement community actually based in the US, and they were bringing in each of their different staff teams into like their communal learning area, giving all of them a phone with ChatGPT on it, and basically being like, hey, just brainstorm what issues you're having, and letting people co-create their own AI solutions
I see.
on what they were doing, which I just thought, I mean, again, it was a big retirement community in the States, have a lot more resources than most people over here, but I thought what an amazing way to kind of give staff the ability to go, these are our trouble areas, these are our pain points. Oh, and this is something that we've now created as a potential solution.
Yeah.
So yeah, I'm like cautiously optimistic about it. I just think people need to do proper risk assessments, as you would with any new bit of technology or any process change.
Yeah.
Right.
And when the thing that I feel most cautious about is the speed with which it's entered our industry. So if you think about like just our, the technology that we use, 20 years really in the making before. I mean, it's been utilised that whole time, but before it's kind of as prevalent or as obvious to people as it is now. Sense technology, people talk about it like it's a new thing. It's not. It's been going around for 20 years, but we don't have that history with AI. We're going from zero to everything very quickly. So we need to manage that in a way that works for people.
We do, and I think part of that will be if we can develop some form of evaluation framework, which isn't a massive sort of theoretical thing, but a way of saying, okay, I'm going to trial this bit of AI technology in my service. What are the key metrics that I should be evaluating in the first sort of 2 weeks, 6 weeks, 6 months, so that I know that it is actually doing what it's meant to do, and having that more standardized, because obviously AI is changing and learning all the time. So it can be hard to create that for yourself in-house. So if we go, this is sort of the model by which we can evaluate artificial intelligence or other emerging technologies. It means that you then have that evidence base yourself about how you're managing the risks, how you're seeing that it's right for your service. And then hopefully if CQC walk through the door, you hand them all of that paperwork, right?
And I think a lot of it is just about that data management as well, isn't it? Making sure that you've got the security measures that you would need to have for any for any data that you're sharing or using. And that's the caution with the free versions, isn't it? Is that we're
free versions, you've got to assume that they are processing data outside of the European Economic Area. It'll be in the States or in China mainly. So as second you put any personal data in there, you're immediately breaching UK GDPR. So we don't have specific AI legislation yet in this country, but there is still legislation which we already have to be aware of, which you could fall foul of at the end of the day.
So it's just making sure we're clued up on that. Another string to our bow, but another area of expertise that we need in social care.
And this is it. There's so many different areas. It's changing all of the time. But the thing is, there's lots and lots of people who are technology experts, but they don't have expertise in social care. So I think my big want is that more people who work in social care feel like confident enough to ask their software suppliers, to question technology industry, to say, okay, I might not know how an algorithm works, but I know how social care works. I trust my own professional judgment in this area to ask you questions that I need to know to feel confident in this technology. And when I speak to software suppliers, and I'm sure you feel this as well, software industry likes it when they have questions from their customers, because they're like, okay, well, they're going to be more on board. They're going to give me feedback about ways to improve my product. It can be a two-way relationship, and it should be.
It should be, yeah. I was about to say that. I think fundamentally, when you do co-produce these things, when you have got good feedback and you're in tune with one another, and you've got sometimes it needs to be really constant feedback, like a weekly, you need to invest that time to develop what works for people, then you're going to get the tools that you need, and they're going to be the most successful, surely.
Yeah, absolutely.
So AI excluded. What else? I think we've covered it. What else do you think? What's next for you? What's your next focus?
So I'm really interested at the moment, and if anyone knows a lot about this, I'd be interested in hearing from them as well, about technology and the environment and environmental sustainability, and how we can be making sure that the way that we use technology in the sector is also not damaging like our local and like international environment. There's quite a lot of evidence, for example, like some of the rostering systems of your own home care, actually moving to a digital roster means you're massively reducing the amount of time people are spending driving around in a car. So you've got carbon offset through that. So I'm not saying all tech is bad for the environment, but I think it'd be quite interesting to understand how we can be more purposeful about the way that we use technology, and particularly sort of the repair and reuse of specific hardware. Like I speak to a lot of working age adults learning disability services who are always trying to find like laptops, tablets, like mobile phones for the people that they're supporting. But it can be quite expensive and there's not really funding for that. But increasingly we're seeing community groups all across the country now who partner with massive like corporate industry. When they're done with a laptop, they hand it to this community group who then completely wipe it, restore it. And you can get another 3 to 4 years of life on these devices. And you can get access to them much more cheaply. So then we're kind of tackling digital inequity for people who are quite often digitally excluded. And I think, for me, I think access to technology and sort of equitable access is something I'm really interested in at the moment.
Because we're good at creating new things, aren't we? And then thinking about the impact afterwards.
Exactly.
Oh, this is a great idea. Oh, actually, there's some problems with this.
Maybe let's just hit pause on some things. But, I think there's just so much that we can see. Like I've said for a long time that like my long-term goal in social care in terms of technology is that by the time I need to go into a nursing home, we would have a fully integrated health and social care record. So our average age of entry into a nursing home is, I think, 85. I'm 35 until Thursday, and then I turned 36. So I was like, 50 years, that feels reasonable. I think it feels more achievable now. I genuinely think in the next 10 years we will have a fully integrated health and care system.
We've talked digitally about it for a long time. Not digitally, just generically.
Yes.
And that's been a struggle. I think we've tried different iterations of it.
Yes.
And when one side leads, there's always that tension, isn't there? So we've had all of that. But I've seen some really good work in ICBs around that genuine integration, around, because it's just about people, isn't it? It's about getting people in the same room. What does it, and okay, we've got two different systems to work through, but the reality is we've got the same problems to work through.
Yes.
So it's when you get people together, I think they come up with the answers.
That's it. And I think, we've spoken about it for a long time about being person first, and it's the person's data. But I do feel there's a real shift in how ICBs and also like national government and NHS England are talking about things. So moving away from what's the place and the setting as to, okay, this is the person, regardless of where they are in the system or at what point they come into it. How can we help them? And I think, the 10-year plans talk about the NHS app and giving data back to people could potentially be something which actually means we are taking that step to actually having it around that person.
Because it is their data, and if they take it with them, then it doesn't matter where it goes, does it? It's not about that system's data, because there is ownership of data. We see it, don't we?
Of course we do.
And even though we know fundamentally it's the person's data, we still see, systemic or, we still see systems owning the data rather than the person. So I think
paternalism.
I think it's absolutely that shift that will change things, and it feels like it's coming.
I think it does. And I think demographically we'll see more of this. If you see research around Gen Z, so 18 to 24-year-olds, they're actually much more interested in data privacy and data ownership. They really sort of feel that it's something that they should have control of. So we have arguably the first digital only generation. They don't remember at all a time before the internet, for example.
No. Tell my kids I didn't used to have a phone as a kid.
Yeah, exactly. And so they are very much expecting to have more control over what they are doing. And so, if we're thinking about, what's next in terms of tech, we need to be aware about the demographics who are coming up behind us and the ways they're going to expect technology is used.
Yeah, absolutely. Okay, so with all that in mind, we've got a very different landscape ahead of us than what we saw just 6 years ago, maybe.
Yeah, I think so.
So what would you say the future of good care looks like?
Okay.
This is a very specifically Katie question.
Yeah, it is. And it's a very big question. I was thinking about this quite a lot on the drive over here today. So I think for people who are already using health and care services and who are sort of already quite using social care system, it's about how can technology be part of their choice in how care is delivered. Where can they choose for tech to substitute for in-person, and when can they make sure that the in-person care and support is right for them wrapped around within it? So more choice there, which is difficult because it tends to be sort of local authority funded technology or commissioned services. Yeah. So that involves a whole conversation. But I would like to think that in the future, people will basically be given options of a range of different, person-centered solutions and also technology solutions to wrap around them and their community in the place that they want to live. So that's sort of one thing. More broadly, for all of us, I think we will be moving to a much more preventative model of care.
Yeah,
we have to, obviously, with demographics and everything. But, we've got the National Genomics Library and genuine conversations about whether there'll be genomic screening for every single citizen of this country, which means that we'll have really good prediction about potential future diagnoses, where your risks are, and then you can start suggesting to people, okay, well, you are at greater risk of heart disease or liver failure in your 70s, you're now 20. These are things you can choose to do to mitigate that and to prevent that from happening in the first place, or to put that off from happening until much, much later. So that means we're going to have a lot of quite complicated conversations, I think, across the entire population as a whole. We're going to have to talk about significant data infrastructure, obviously, to have that data safely.
And then linking that with the sustainability aspects.
Exactly.
Well, we hold more data, we hold more service.
Definitely. And we're going to have conversations with people about what data are they willing to sort of give up in some ways, in inverted commas, in order to be given these more preventative treatments. Because it's something that, you would have to be part of a huge database. Some people will be more comfortable with that than others. And then finally, we're going to have conversations about trust and transparency. The only way you can have like a massive national data resource like that, which the government's currently talking about, is if people trust that the government can keep that information safe. So I think for me, that's something which is likely to come. I think it's quite exciting. I think it's going to be difficult to have. But I think it's going to put us all into a place where we feel much more empowered to manage our own health and care throughout our lives and have the data at our fingertips to do so.
Yeah, brilliant. Yeah. Sounds good.
Yeah, sounds
Where
scary.
do we sign up?
Fine.
Oh, that's really good. Thank you very much. It's been a really interesting session, looking to the past and to the future. So it was really good. Thanks for your time.